We couldn't think of a sexy acronym, sorry. One of the first experiences I had working in public health was actually working on HIV prevention. And in Venezuela, one of the things that they asked me to do was go to one of the local universities and help with condom distribution and basic sex ed. And we took a box of 1,000 condoms and they were gone in about 20 minutes, just gone. I got into some casual conversations where they would be like, yeah, but I've got these, but how do I use them? There were issues with things like adolescent pregnancy, outbreaks of STIs, and non-consensual sex, and underlying it all was the fact that people just couldn't talk about it openly and they couldn't get good information. There's not another area of health where we don't understand the underlying behaviors. So think about trying to work in nutrition and not understanding what kinds of food people are eating, not having that as your base data and trying to design a nutrition program. You can't do it, and it's silly to even think that you can. And yet, we do exactly that for reproductive health, for sexual reproductive health, for HIV prevention. So we undertook this year-long process where we asked researchers around the world who were working in the space to share the instruments that they were using, brought people together in a hackathon to hack together what a basic abbreviated survey instrument could look like. And then over about the last year and a half or so, we've worked with researchers in 19 countries. They've all translated the instrument, and now they're testing it. We will have an instrument where we can say, no, you can ask these questions, and you can ask them to people who are 15, and you can ask them to aunties who are 65 in a rural area. And so I think when we have these kinds of data, what the people in ministries of health can do is they can better design information and programs to meet the actual needs of people. HRP, as a global convener, we have a really powerful and important platform through which we can generate evidence, we can consolidate evidence, and we can get it out to the world and hopefully see practices change.